Just today, Talia sent me an email that we received. It's from a patient that lives in Poland, Polish lady. She's a midwife, and she sent us some pictures asking if we could help her. So we'll check out the pictures. It's really scary. She had a hairline lowering surgery, and I think it's a case where we want to share why it's so important to really understand who is your surgeon and how many of the cases do they do, because things didn't go well with her. Just a couple of hours after surgery, and I can already tell there's a lot of swelling, too much swelling really. But this is how much hair loss she had in the first 24 hours after surgery, which shouldn't be that much. Some hair loss can happen, 10 to 15%, but not 24 hours after surgery. So from the very get-go, things were going south. This is 2 days after surgery, the stitches are all in place, and there's already this huge scab, like a crust in between the wound gaps. And it's just getting worse and worse. This is about a week or two after surgery. The stitches came out and you see dead tissue. See, there is no hair. She lost all her hair. There's some scabbing in there. It's really scary. And imagine that this is your face and you were going into surgery in the hope for something better. And this is what you receive. So yeah, I feel very, very bad for her. She literally went through hell emotionally. The thing that makes me very sad is the surgeon didn't want to see her. She had to go to A&E to take care of the necrotic tissue because he said, it's your fault, I did everything right, which is sad, and it shouldn't be this way because it's a privilege to operate on patients, but with equal privilege comes responsibility, and it looks like he wasn't taking care of his responsibilities. So that's where, you know, I have an extra emotional level to this where I say, okay, let's help her. She's a midwife, she's part of the tribe, as I always say. She went through hell, and clearly she needs help. So yeah, we'll have her in.
Hairline Lowering Surgery.
Here we go.
We don't know what kind of procedure was done in detail previously, obviously a hairline lowering surgery, but I don't know what arteries are compromised, and at the end of the day, hairline lowering surgery is creating a big flap of scalp tissue, the hair-bearing part of the skin, and we want to advance it. So I'm checking for her laxity, which is great. It gives me two things to understand. A, the extent of previous surgery. If it would be all stuck to the scalp, I would have expected that the whole scalp has been lifted in the previous surgery. The thing that we will do next is take a couple of pictures, and then we will start planning. So here I'm measuring the height in the mid and the lower third of the face. And as a rule of thumb, from the Renaissance age, we always say that it should be somewhere in equal thirds on the face. So all heights should be the same. We have to not only correct the scar, but ideally bring it a little bit lower so that it brings out the beauty of her face more. The plan is not only to remove the scar tissue, but also to lower the hairline, as initially planned. She has a little bit of bony prominence. We call these eminences or tubercules. I have two of those as well. What we can do is we can reduce the prominence on it, basically like taking off the edge. And because she went through so much trouble already, we will throw in a little bit of a brow lift as well. So this is going to be the area of bone contouring. And you see it also in the profile, there's this little bit of an edge. So if we take it down, it doesn't take much, it's like 1 or 2 millimeters max. It softens everything. Somebody's really nervous. I see the pulse. I check the arteries. I will give the hyperbaric oxygen before surgery and after surgery. And I think we have a plan. So we agreed to do the surgery in 2 months from now. And that's the next time we will see each other. The things I love about the HSSH or Harley Street Specialist Hospital is it's a conversation on one level. You know, you speak to the people and they really listen to you. I spoke to the managers and I said, listen, this is a case. She's coming from Poland. She doesn't have the money to fly over to London to have some reconstructive surgery. And everybody agreed to do it for free, you know, and this is something which is very close to my heart. And I know that we get more out of this, if everything goes well, than any money in the world could give us. And that's the right thing to do.
A headband in Polish is called opaska, which I've just learned. And she said that she was hesitant to buy one, but she can't wait, and she has a few that she was actually gunning for, and she's hoping that she can buy a few of those. So let's make it a good goal. I want a selfie with opaska. So basically the goal is to create a nice arch, bring the eyebrows a little bit higher, her left eyebrows a little bit lower, to equalize it so that they sit in a similar position. I always say they are sisters, not twins. The arrows show me how I have to pull on the eyebrows to create more symmetry. The cross-hatched area on the forehead indicates the areas where I want to reduce the bony prominence, so it's a little bit more flattened, not as prominent and not coming out as much. And this is basically the line that we will follow. Jak wszystko będzie dobrze, to ja chcę mieć selfie z ciebie, z opaską, dobra? Okej.
Może początkowo w domu, ale później w pracy też będę chodzić.
Absolutely key is the conversation that I have with the patients before they come into theatre. I win their trust, that I find out about them, they find out a little bit about me and what's going to happen. And actually, it's that initial talk that just calms them down a little bit.
Mr. Bran is a qualified hairdresser, just for the record, you know.
Also known as the German barber. Yeah, it was tricky. I think it's going to be really good. It was a big block of scar, really, everything. So you have to be really careful. Whenever you make incisions, you cannot compromise any blood supply, so that was a bit tricky, but yeah, we did a good job, I think. And we did the bone contouring, the brow lift, and so everything heals nicely. Tomorrow is a big reveal. We'll leave it on for one night, and yeah, looking forward to see your eyes tomorrow.
Normally in recovery they're very sleepy, which is normal after sedation or any other type of anesthetic. They're very happy, they come in and they go very happy home, so that's just the biggest reward we have.
Plastics wise, Bran is a fan of the piezo, so he's got the piezo and we've got several different kits for his rhinoplasties. We're really into our enhanced recovery here, so pushing what we can do as DKs.
Most of the people here I've worked with in a previous role, a lot of them are hand-picked and they're just damn good at what they do.
Nie było mojej pierwszej operacji, okej?
No nic nie widzę żadnej martwicy.
Nie sądzę, że tam będzie jakaś.
How do you feel?
Good.
Yeah?
Yes. It's not pain.
Quick relief.
Yeah.
That's pretty good. She looks great. She doesn't have any pain. She looks much better than before. First time she had massive swelling on the head. So yeah, she's a real trooper. I mean, yesterday, just before surgery started, she was just shaking. Her whole body was like that. So she's very brave to go under this again, you know. This trust of my patients means everything, and this is why you try to deliver everything you have for them. And, you know, every patient counts. Every patient counts.
Now it's 9 weeks after surgery. I can show my forehead. Even my friends from my work notice that I have a bang like this, not cover my forehead. My tip to another people: good research is it's all.